Welcome to the FAB Center for Innovation 21st Century Learning Community Interview Series. In each video, we hear from public health leaders about their work and what they've learned. I'm your host, Naomi Rich. Today, we explore how the health department in Lane County, Oregon, operationalizes the Community Partnership Development foundational capability through their Community Partnerships Program. Joining me today from the Lane County Public Health Community Partnerships Program are Mo Young, Community Partnerships Program Supervisor, Olatorera Adeniji, Outreach Coordinator, and Jennifer Webster, Epidemiologist. Thank you all for joining us. Mo, what is the Lane County Community Partnerships Program?
The Lane County Community Partnerships Program is a program that came directly out of public health modernization. Community partnerships is one of the foundational capabilities of modernization, and it's really the key to doing effective public health work. I like to describe the program as being a stool with three legs. We have one leg that is public health modernization, we have one that is antiracism, and we have one that is abolitionist theory. And the stool wouldn't stand without all three of those legs, and our program wouldn't exist.
Olatorera, why is it important for a health department to engage and collaborate with community members on public health solutions?
I think this is an excellent question, and it's important because I truly believe that community holds the answers and has the best answers. In all of these situations of public health crises that we've noticed, communities working closest within one another in a mutual aid aspect. And so honestly, they're responding a lot faster and adapting to these emergencies before we even are on the streets or in the polls. So I believe making sure that the voices that are closest to the problem are centered when we make sure to figure out responses or how we're going to act and interact with folks in public health. So just making sure it's community-centered is the most important part.
Jennifer, tell us how data figures into this approach.
So public health as a field is really committed to data-driven decision-making. And so in order to have the best possible data, we really need to collaborate with the community to ensure that our data is grounded in people's lived experience. So too often we think that numbers tell the story, but really they can't speak for themselves. And every data system we have relies on thousands of decision points, from what questions to ask, to what variables to study, to how to present our findings that are steeped in our cultural and personal biases. So in order to effectively address inequities, we have to take direction from the communities most impacted by those inequities. And that means we have to make sure that the community's voice is present in the data we use to make decisions. And the other important thing is that we really need to recognize different kinds of data. Not all data is numbers. So we have to treat anecdotal stories and requests from the community as valid data. So for example, if our partners are telling us about barriers, such as needing information in multiple language or in alternative formats, then we really need to treat that as valid data and act on it.
Olatorera, have you seen the work of this program benefit other health department programs?
I really think it has, actually. We're really good at modeling. I don't mean to toot our own horn, but we practice what we preach, and we live by our values that we've put together very thoughtfully. And so I think being able to model within our program itself is actually kind of spread out and had a little bit of a rub-off effect on our colleagues. We're seeing folks, practice things in ways that we do in CPP. And we lead with an anti-racist and abolitionist lens with community first. And so it's really nice to see our colleagues really taking those aspects under their wing wholeheartedly in the work that they do as well.
Mo, how are anti-racism and equity principles represented in the Community Partnerships Program?
So because the Board of Health has declared racism to be a public health crisis, and because the community has directed not just Lane County, but our partners in the Community Health Improvement Plan to collaborate and build a more equitable community and system by making a commitment to naming the history that brought us here. We in community partnerships have permission to do this work and to focus where we're focused. I would say that not only do we have permission, but we have language that our leadership has, approved, and we are better able to, say, spread the word that inequities exist and that disparities exist, and that those are caused directly from racism, colonialism, and genocide. And what we know in community partnerships is that the people who are closest to the inequities are the ones that know the answers, are the ones who know how to fix what's going on in the community, in our system, not just here in Lane County, but really across the globe. And our job as public servants is to find and ask the questions to get us there. So to find the right questions, to get the right answers from community, and then also to listen when we don't get it right or when they don't get it right. To really be willing to be flexible and change course.
Jennifer, what's your advice to others who might want to build a community partnerships program?
I think the most important thing is that it's not what you do as much as how you do it. So committing to centering the community means you have to move at the pace of trust, and you have to develop non-transactional relationships. So what we do is spend a lot of time with our partners outside of asking them for things. So like we listen to their concerns, we learn about their work, and then we offer assistance when we're asked. And these things take time. So we've had centuries of inequitable systems creating the inequities we see today. And hopefully it won't take centuries to transform and build more equitable ways of doing things, but it's certainly not going to happen in 1 or 2 grant cycles. There's no easy fixes, and we have to commit to doing the work of undoing and being in it for the long haul. So centering the community to make meaningful, community-driven public health means really slowing down and taking necessary time to do the work this way. And then I think the other thing is it also means using an anti-racist lens. So we are all of us steeped in the history and culture of white supremacy. It's baked into our systems. And so we need to consciously and actively work to make the invisible visible so that we can consciously and actively change how we do stuff. And it's hard, slow work, but the end result is a healthier community for everyone. And the last thing I'll say is take time to celebrate the victories, big and small, and find the joy in the work.
Thank you, everyone, for being with us today. You can visit the show notes for more information on Lane County's Community Partnerships Program and how you can operationalize the foundational capabilities in your public health system. On behalf of everyone at the FAB Center for Innovation, thank you for watching.